Thank you for that report, Victor Ogale. Now, moving away from that, it is no news when there are reports of Kenyans going abroad to seek healthcare. It's also common for fundraisers to be called in support of a sick relative or friend just before their flight far away from home in search of better healthcare. Well, KTN's Dr. Masi Korir spoke with Apollo Hospital's Joint Managing Director Sangita Reddy during the visit to Kenya by the Indian Prime Minister Narendra Modi. Apollo Hospital is one of the major hospitals in India where Kenyans often seek healthcare.
Patients come to us in India for treatment and we're happy to take care of them. The long-term vision is to do capacity building in Kenya itself. So the MOU with Kenyatta Hospital, which we're very happy to be signing, talks about uh, joint sharing of knowledge, of exchange programs between doctors and nurses so that there will be a training and a learning, and of doing program enablement. So, for example, one of the critical areas in this is to establish a liver transplant program in Kenya. In any scenario, I think that there would be a few who could have been managed here, but primarily, let me tell you, that there is a great need, and we have saved patients who came in acute cancer. We've done brain surgery, we've done heart surgery. At the current stage, I think referral is the best thing, but parallelly, the government, the public, players like us must create a plan. But a hospital is not just a building. It is a combination of the building, the people, the equipment, and the systems and the ethos to care.
All right, let's now go to Turkana County where our reporter Elvis Guskay brings us more on the Turkana Cultural Festival. What's the latest from Turkana? I understand this is the last day of the festival. Elvis, if you can hear me, what can you tell us about the festival today? All right, so we will be linking up with Elvis Koske a bit later on. But let's now speak to our in-house Dr. Masi Korir on that clip that we just ran. Kenyans continuously and increasingly going abroad to seek treatment. Dr. Masi Korir, thank you for joining us in studio this morning. So why? Why do Kenyans go abroad for treatment?
It's a number of reasons, from our state of healthcare to just individual decisions. Because I'm imagining if you're faced in such a situation where your loved one is in a critical condition or needs critical care or some form of specialized care, and you're faced with a choice to give them the best healthcare form of healthcare that you can afford, I think most Kenyans choose to get the best, regardless of the cost or where that healthcare can
So
be
that means
found.
we don't have the best in the country.
No, the best is relative because, as I said, it depends on, most people usually say healthcare, the quality of healthcare that you can get depends on how much money you can spend, which
afford,
is quite
right.
actually unfortunate because healthcare is quite a vital part of any country's development and it should always be prioritized. So I think one of the main reasons, and I think it has come over time, was people always used to complain of misdiagnosis or late diagnosis.
Right.
So and I think this was coupled by back in the day we did not have the best diagnostic capabilities around. So you would get either diagnosis is not made early or the wrong diagnosis is made or there's some just mishaps because of our diagnostic capabilities. So over time people found that when they go to another country then they get diagnosed and treated early, the best outcome. So I think over time, people have not been able to actually get out of there. But the good news is we are actually improving and we are getting to make diagnosis or our diagnostic capabilities is improving. Another reason is some of some of our facilities do not offer some services, specialized services. Like for example, as we heard from the clip, we don't have a liver transplant in Kenya.
Right.
So in a situation where you need a liver transplant or somebody needs a liver transplant and it's not available in Kenya, and that is a life-saving measure for them, then they'd opt to go elsewhere. So there's those situations where it's necessary or absolutely necessary, and there's those situations where it's actually personal choice. And as you say, our constitution allows us to get the best affordable quality of care.
Right.
And if it's not available here, then what options are people left with?
Right.
Yes.
All right. Well, we'll
Yes.
continue with this conversation a bit later on. Our in-house Dr. Masi Korir there on that issue, which brings us to the end of a KTN News Center for this hour. Thank you so much for watching. My name is Michelle Ngela. Do join us at the top of the hour for more.